Hello everyone. Today we are here with Dr. Elisa, consultant ophthalmologist, Barraquer Eye Hospital UAE. Hi doctor, how are you?
Hi, good, thank you. And you?
Great. To start with, could you tell us a little bit about your journey within the healthcare sector?
My name is Elisa Carreras. I'm a consultant ophthalmologist, super specialized in retina, mainly in vitreoretinal surgery for adults and pediatrics. I have the two backgrounds where I have been trained. One is Barraquer, Barcelona. Another one is in United Kingdom. So I have this mix of Spanish and UK knowledge about retina.
To start off, could you explain in simple terms what the retina is and why retinal detachment is considered a medical emergency?
The retina is the most important part of our eye. Imagine the eye as a camera. The retina is the sensor of the camera. Whatever we see, it goes to the sensor and from there to the brain. So it doesn't matter if you have good lens, bad lens, that if the camera sensor is not working, you are not going to see properly. A retinal detachment is with these camera sensors peel off from the wall of the eye. So imagine that the room is your eyeball, the wallpaper is the retina. Any lesion in the wallpaper that can peel it off, it will damage your vision and it's going to stop the camera sensor to work. Okay, so it's an emergency because when the retina is peeled off, no blood supply is reaching to the retina. So there is no food, no oxygen for the retina cells. And this time that the retina cells are without blood supply, they are suffering and dying. So as soon as we redetach the retina in place, better visual results you will have. Okay? That's why it's an emergency.
Like a lot of people assume eye damage comes with pain. Is a detaching retina painful?
So that's the important part. Very good question, because the retina doesn't have pain receptors. So you are not going to feel it as a pain. Only going to see visual changes, like floaters, flashes, or dark shadow coming to your vision, but no pain. That's why mainly most of the people think that it's not a serious problem because it's not painful. So this is, you have to understand that pain, it's different from emergency and it's not related to the retina. Retina always it's painless. Whatever it happens to the retina, it's not going to be causing pain into your eyes. Only visual disturbances.
So, what are the very first visual warning signs someone might experience before complete detachment occurs?
There are three major symptoms that the patient has to be aware of. One, it's floaters, black things floating in the middle of your eye. Are very typical that when you see one floater, you want to follow it and it keeps moving. That's very important. They are seen sometimes as spawn webs, spider webs, black things moving around your visual field. That's one of the warning signs. The second one is flashes. Flashes is like flashes of photo coming from the side of your visual field. And the third one, a black curtain, like a shadow coming from any side of your visual field. So these three things, if they happen, you need to go quickly to see an eye doctor.
So, many people see occasional floaters. How can a reader distinguish normal, harmless floater from a sign of retinal distress?
The key point is change. So anything new in your vision, this is the time to go to an ophthalmologist to be checked. Few floaters that you have seen them for a while and always has been the same, usually this is not dangerous. But when you suddenly see new floaters or you suddenly they change in the shape and if they go with flashes of light, with dark curtain, then it's when you have to go to be seen by an eye doctor as an emergency basis.
And who is most at risk for retinal detachment? Like what kind of people?
Everyone is at risk, but the group of people who are most at risk are people who are high myopes, so people who need glasses for distance, because these eyes are longer eyes and the retinas are stretched and thinner. So any traction or anything, it's easier to happen to your retina. So people who are wearing glasses for distance, that's number one. Aging as well, because inside of the eye, the gel that we have that is responsible of this peeling of the retina, it changes over time. And there is certain time in our life, around 60s, 70s, that this gel suddenly collapse and can pull the retina with it. As well, people who had kind of surgeries in the eye, like cataract surgery, people who had any accident in the eye, anything that can change the anatomy of the eye, it makes you at risk to have retinal detachment. Some patient is something that runs in the family. So there is people who genetically has more predisposition to have retinal detachment.
So what happens if someone waits a day or two to see if the vision improves on its own?
Time is critical in these patients because the retinal detachment usually starts in the very periphery of our vision, but it can progress very fast. This progression is affecting the center of the vision, then the vision can be irreversibly lost. So that's why time is very important, and sometimes it be 24 hours difference. It can make a full impact in your vision. So as soon as you get the treatment done, better chances you will have to keep your vision as it was before the retinal detachment.
So if a person recognizes these symptoms right now, what exact steps should they take today?
They have to go as soon as possible to see an eye doctor. If it's a retina specialist, it's better. But they don't have to call and get a routine appointment to be seen in 1 week time. They have to be seen on the same day or the following day.
And in brief, what do modern repair treatments look like today?
So nowadays there are 3 main treatments for retinal detachment. If there is not yet retinal detachment and only a tear in your retina or little retinal detachment, you can do only laser. That is a very simple treatment to do in outpatients. If your retinal detachment is bigger and has progressed, then there are 2 ways to treat it. One is called vitrectomy, it's surgery from inside of the eye, and surgery from outside of the eye, that is a scleral buckle. It's kind of put a bell around your eyeball to fix the retinal detachment. Usually intraocular surgery are more for elderly patients or patients above 50, I would say. Outside surgery, scleral buckle, external surgery is more for young patients because we don't want to go inside of the eye in young patients.
So with advances in retinal surgery and ophthalmic technology, how have outcomes for retinal detachment patients improved, particularly when treatment is provided early?
So the advantages is the main one, it's measure success rate. Okay, because before, when we didn't have these machines to perform vitrectomy, we were doing buckles and not all the surgeries were successful as nowadays. So one, it's this, the successful rate and the recovery of vision of these patients. The redetachments, the number of reoperations, it's less as well, and the comfort for the patients. Because nowadays we have a small incision techniques and the inflammation that they get after the surgery, it's very low. Nowadays as well, we have gas to put inside of the eye to manage the retinal detachment. We have very good lasers and very fine and precise instruments that makes to have a retinal detachment after the surgery, you can be as good as you were before the detachment. That probably 30, 40 years ago, it was not like this. Because I didn't say that, but a retinal detachment, if you leave it untreated, you will lose your sight completely. So it's something that it's an emergency, needs to be treated. And nowadays, with the machines and the technology, in 99% of the cases, it's a successful treatment.
So it's like need to be taken seriously.
Yeah, it needs to be taken seriously, and you need to trust the doctor to have the surgery as soon as possible, because sometimes patients, and they're on the right, they want to think about it because they are shocked when you tell someone that needs a surgery and they want to seek for second opinions. But this kind of pathology, it's not suitable for that, because as much time you are losing seeking for second opinions or thinking about it, less chances to recover your vision you will have. And this is very important in our job to make the patients to understand this concept, that it's an emergency, needs to be treated in order for you to recover the vision. And for that, as a doctors and as a hospital, we need to be ready to do a surgery at any time, but the patient need to trust us as well. Right. And have the surgery as soon as possible to have the best visual results.
So is it like a fact or myth? Reading in a dim light will damage the retina or not?
It's a myth. So reading on a dim light, it's not going to damage your retina. There is no problem for that. You can get tired and your vision can be tired, but it's not going to damage your retina. Usually, as we discussed, retina is damaged because you are high myope, you had any kind of surgery in your eyes, you had an accident, or it's something that runs in the family. But it's nothing that because you have done reading or making visual effort, that's going to damage your retina. It's not like this.
Okay.
From the retina point of view, one healthy habit that everyone should take and it's a bit silly, but covering one eye, covering the other, and make sure that your vision is equal in both eyes. Because sometimes when both eyes are open, we don't realize things happening in one of the other eyes. So from the retina point of view, there are many other things that I can recommend, but one that sometimes people forget, it's covering one eye, covering the other, make sure that your vision it's equal in both eyes. I can say other things like healthy diet, control your sugar, your blood pressure, your cholesterol, but I think these ones everyone already knows. For parents, I would like to recommend to cover the eye of your child, cover the other, make sure that the vision is equal in both eyes. Because kids are the most important one to do this test because they are compensating their vision and they can adapt to any situation that if something happens in one eye, they don't realize, and when they complain, it's too late. So just check. It's very simple test. Cover one eye, cover the other, and make sure that your kid can see the same with each eye. If it's not the case, then you have to go to an eye doctor to see why is it happening. It could be the retina, it could be lazy eye, it could be cataract. There are several things, but that's a very important test because usually kids delay complaining about loss of vision in one of the eyes.
So finally, coming to the last question, what is the most important message you would like our audience to remember about retinal detachment and the importance of acting quickly when warning signs appear?
So please be aware in your vision if floaters, flashes, or any dark shadow appears. If this happened, you need to be seen urgently by a retina doctor, if possible, if not a general ophthalmologist, in order to make sure that your retinas are safe.
That was Dr. Elisa from Barraquer Eye Hospital. Thank you, doctor, for speaking with
My
us. Thank
pleasure.
you so much.
My
Thank
pleasure.
you.